Thank you everyone for being here this evening. Welcome to tonight's town hall. My name is Kate Shelby. I am the backbone leader of the Teton Behavioral Health Alliance, which is an initiative of the Community Foundation of Jackson Hole. Thank you to Patty Rocha, who is providing live Spanish interpretation for this evening's program. If you are in person and would like to utilize the Spanish interpretation, we have headsets in the back. For our Zoom audience, please click the Spanish interpretation icon that's at the bottom of your screen that looks like a globe. And that you'll select your language preference, click the mute on the original audio to only hear the interpreted language. So I'm going to give us a second to see if our Zoom and Spanish interpretation is set up.
No, it's one of the first time writing it.
Okay. Does anyone in the room want headsets? Okay. For our Zoom audience, do we need any tech support to make sure folks have access so far? Okay, great. Earlier this year, the Alliance conducted 2 surveys to assess behavioral health in our community. The first survey was for the providers and to identify what mental health professionals were observing in their clients and in our community needs to figure out where the gaps and overlaps might align. The second survey was the Community Behavioral Health Needs Survey, and that explored the public's views on mental health, substance use challenges, and access to care. Third Horizon Strategies is an advisory firm that we used as a consultant to analyze the survey findings, identify trends, and make recommendations. Tonight, you will hear the findings from those reports. In addition, we have Michelle Teton from Legacy Works, who will walk us through the new behavioral health dashboard presentation, which is a tool for exploring key metrics on behavioral health so that all community members can access the data. We'll have a Q&A session after the dashboard presentation, so please hold your questions to that time. Thank you for joining us, both virtually and in person, and for your commitments to our community's behavioral health. To provide context for what we'll be talking about today, I'll explain what the Teton Behavioral Health Alliance is, provide information about the national behavioral health landscape, describe the unique needs that we face in mountain communities, and explain the survey methodology. To share the purpose of the Teton Behavioral Health Alliance, it emerged from the Community Emergency Response Funds, which was launched by the Community Foundation with local nonprofit partners in 2020 to address the challenges brought on by the COVID-19 pandemic. To better understand the behavioral health needs in our community, the Community Foundation hired a consulting firm called FSG to form a steering committee to map the behavioral health continuum of care and conduct Teton County's first ever behavioral health needs specific assessment in 2020. Based on the survey, an action plan with recommendations was shared with the community in November of 2021. By the spring of 2022, the steering committee formalized into what is now the Teton Behavioral Health Alliance, transitioning from an emergency response to a structured initiative with the support of the Community Foundation's board. Since then, leaders from multiple sectors have participated in various working groups and continue to meet regularly. The Alliance serves 3 main purposes. We convene individuals who are affiliated with organizations, agencies, and practices that are invested in the behavioral health outcomes of our community. We coordinate efforts to create more effective and responsive behavioral health systems, leveraging our collective strengths to work towards shared goals. And we facilitate meetings and events with the Alliance and with the community to cultivate collaboration and promote our work through shared action. The mission of the Teton Behavioral Health Alliance, which if you've heard me talk about this before, you'll hopefully remember this. It took our group over 75 hours to land on this mission. So a lot of wordsmithing, but really that shows the level. And I think that there might be some reactions to our group of like, yes, I remember each of those 75 hours. But that really shows the level of commitment that we demonstrated to have it be based on consensus and to make sure that it truly reflects the work that we intend to do. So our mission is to improve the behavioral healthcare system in Teton County by facilitating community-wide actions that enhance prevention, treatment, and crisis response efforts. We address the gaps and inequities in the system to benefit all who live and or work in Teton County. We could not do this without our community partners. So the Alliance is a collaborative network of over 20 organizations from diverse sectors working together to enhance our behavioral healthcare system. You will hear from many of them this evening, and I would ask if you are a member of the Alliance, so in any of the working groups, if you could raise your hand at this time. Yeah, we have some incredible rock stars that are dedicated to this work, and thank you so much for it. To talk about how our work falls into the context of the national behavioral health landscape, our work is shaped by these national trends. As you folks all can probably guess, the COVID-19 pandemic led to a sharp rise in mental health issues, including pause to make sure our tech side is okay. We're good? Cool, thanks. So COVID-19, we saw a sharp rise in mental health issues, everything from anxiety, depression, to eating disorders, etc. We've also seen a rise in demand for services from anything from substance use disorders and bipolar disorder. The other piece that we're seeing in the national level is high levels of burnout from our providers. This can be related to the shortage of professionals in the sector, but also limited access to care. So the number of providers that we have are seeing higher numbers of caseloads and more severe caseloads than they have historically. All of this is viewed within the context of being a resort community in a rural setting. So in recent years, there have been a growing awareness of mountain resort communities' unique and serious behavioral health needs. So we're in collaboration and partnership with multiple mountain communities, and they are experiencing similar things that we are experiencing. So that allows us, one, to put it in context of that, and two, to also leverage their learnings and adapt them for our needs. Some of those things are pretty obvious to those of us that live in this area: high cost of living, housing insecurity, lack of available childcare. All of these are social determinants of health, and they can erode overall well-being. We also know that living in rural and remote areas, we face challenges with limited transportation, longer travel times to providers, and that is exacerbated by harsh winter weather. In mountain communities, we're also seeing that there is a unique stigma that is in part due to the strong belief in self-reliance. So this idea that as Wyomingites, we believe that we are strong and independent and can do everything, and that asking for help might make us be perceived as weak. It's up to us to really combat that stigma and normalize asking for help. So additionally, close-knit communities can discourage people from asking for help. So if you have been in the community for a while, maybe it would be intimidating to call a place like mental health and recovery services when you're friends with some of the therapists that work there. And that can be a reality in our small, tight-knit community. We've also observed that mountain communities are becoming more culturally and linguistically diverse. but that the providers aren't necessarily able to meet the care of those needs of non-English speakers. So this makes it even harder for marginalized groups to access care. Now to talk about the survey methodology. Before we review the data and finding, to give you a background, the Teton Behavioral Health Alliance partnered with the Katz Amsterdam Foundation to develop and conduct the surveys back in 2020. We partnered with 7 other mountain communities, including Aspen, Crested Butte, Eagle County, Colorado, Tahoe Truckee, Park City, Summit County, Colorado, and Telluride. So these are some of, but not all of the mountain communities that we're in collaboration with to share ideas. So all of these groups got together to develop their original survey instruments. And that survey was administered in those multiple locations to allow cross-community comparison. We conducted that survey again with some additions to it in January and in January and February of this year. We did extensive outreach to both English and Spanish speakers and other immigrant populations, to anyone who lives and or works in Teton County. We had a total response of 1,142 for the community survey, and 131 responses from providers. So those numbers are significantly higher than what we had in the first wave of having the survey conducted. From there, Third Horizon Strategy was contracted to analyze the data and compile a report on their findings. Like all surveys, there are limitations to ours. Due to the very small sample size, data on gender identities other than male and female and sexual orientation was omitted. This means that additional health disparities may exist, but cannot be scientifically analyzed. To address that, I want to remind you that the Alliance's work is guided not only by the numbers, but also by the stories of the community members that we serve. With all of this context in mind, I am pleased to introduce Rosie Reed, who will be sharing the findings from the community survey about life in the community.
So this section focuses on how folks who live here feel about our community and where they fit in, about belonging. The results indicate that people's feelings about whether they belong here are worsening over time, though only slightly compared to 2021, meaning that the pace of this decline is slow, and we have time to correct course and put more attention into engaging community members and fostering more feelings of connection. The first graph tells us that most people, 4 out of 5, trust others in the community, though there are 10% fewer people now who say they trust others completely than they did 3 years ago. There are notable differences in feelings of community trust between Anglo-English speaking people and those who identify as Latin or Spanish speaking. Marginalized folks don't feel as trusting of others in the community than as compared to those who speak English and are part of the dominant racial and cultural groups here. We could certainly be doing more to bridge these gaps and build trust where there are cultural or language barriers. The majority of people, almost 70%, say they put a lot of time and energy into being part of this community, but nearly half of survey respondents said they didn't feel a strong personal connection to this place. So in other words, many people feel like they're not getting out of the community what they're putting into it. In general, there aren't huge differences between feeling of community trust across age groups, but middle-aged people tend to feel more isolated overall. 1 in 5 people often feel isolated, excluded, or lacking companionship. And these numbers are worse than they were in 2021, even though we're not in a pandemic anymore, which suggests that even though we ostensibly have more opportunities to connect, we need to focus on intervention strategies to decrease feelings of disconnection and isolation. The good news is that the majority of community members feel like they can trust others and belong here. But the lower levels of trust and higher feelings of isolation among certain age groups and differences across ethnicities and languages tell us we should put our energies into building connections and inroads, particularly with those with marginalized identities. Up next, Adrian Croak is going to share findings from the community survey about mental health challenges.
Thanks, Rosie. Do I have to do anything with this, or I just get to talk? Hi, everyone. My name's Adrian. So the section is about mental health challenges and services and supports that address those challenges. So the 2024 survey found a significant increase in the number of days per month that respondents indicated poor mental health, and that's illustrated in these here behind me. While both Latina and non-Latina individuals reported a similar number of poor mental health days, more Latina individuals had more bad days compared to non-Latina individuals. So when asked what creates challenges to their mental well-being from among a list of choices, community members chose the same 3 things in this survey as they did in the last survey, which were, as I'm sure that this probably sounds familiar to a lot of us, housing costs, family stress, work stress. As far as needing, seeking, and obtaining mental health treatment, people who identified as female and younger people, which in the survey is defined as 18 to 39, which is a little, I'm a little offended and scary about that, and so maybe other people feel like that too, but it is what it is. So younger people aged 18 to 39 were more likely to indicate that they needed mental health treatment in the last 12 months. So younger people and people who identify as female, which tracks as far as like help seeking behavior and decreased stigma in those groups. One significant movement in the wrong direction is that when asked, were you able to get the treatment that you needed? Respondents who said no increased significantly from 19% in the previous survey to 30% in 2024. For those who couldn't get services, cost was the most significant barrier, and a much more significant barrier for Latina individuals who were much less likely to receive the services than non-Latina people. And for people who identify as men, the biggest reason for not seeking services were confidentiality concerns. So overall, the survey highlighted several key trends and disparities in mental health needs and access to services. Although about 80% of respondents were aware of resources in the community to seek to support their mental health, only about 40% said that they were likely to seek those services if they felt they needed them. So while awareness of mental health resources is pretty high, 80% is a significant number, actual utilization remains pretty low and a challenge, mainly due to people reported cost and health insurance limitations. Up next is Deidre Ashley, who will talk about substance use.
Thank you. I'm guessing none of this is a surprise to many of the community members that we are matching national trends when it comes to increased needs for mental health and substance use services.
Louder.
I want to note on the substance use side of things, most of the questions were geared towards alcohol use only. And I'm sure all of you understand, as a resort town, we've got that party culture. And looking at the survey results, it's clear about just how important alcohol is perceived to social life. 3 out of 4 individuals surveyed noted that alcohol is essential to the social life in our community. While similar issues are present in other resort communities, our numbers have been higher than in our sister towns. Comparing the responses from 2021, the mean response to the question, in a typical month, how many days did you have at least one beverage, rose from 9.8 to 10 days. And those younger than 65 reported consuming more alcoholic beverages on days that they drank in previous years than in previous years. It's also noted that 40% of those that completed the survey indicated that they have been negatively affected by substance use, either personally or through others, family, friends, coworkers. In short, the survey highlights notable trends in alcohol consumption and perceptions across the region, pointing to the need for targeted interventions and ongoing monitoring to address alcohol-related issues in our community. Up next, we have Beverly Shore, who will share findings from the provider survey regarding availability of services.
The availability of services was a critical piece of understanding access to care. Teton County's provider network consists of highly trained professionals with diverse specialties, including trauma, post-traumatic stress disorder, parenting, family counseling. The majority of providers are licensed clinicians with master's degrees, while fewer are psychiatric providers or peer support specialists. The county has one mental health provider for every 160 residents, outperforming both the state of Wyoming and national averages. 36% of the respondents identified as being self-employed. 33% worked for nonprofit agencies, and 17% work at group private practices. While the majority of private providers are accepting new patients, this is lower than it was in 2021. And fewer providers are now offer services outside of typical office hours, so whether that be evening or weekend, early morning. And most providers can schedule a first appointment within 14 days of contact. But only 35% offer remote care, so virtual options. More than half of providers offer a sliding fee scale for self-pay patients. As you can see from the graph, acceptance of Medicaid has improved. However, administrative costs, those are barriers, and they may prevent further adoption and availability through various carriers, that could be private, Blue Cross Blue Shield, Aetna, United Healthcare, Cigna, and then military as well, which is TRICARE. Up next, Lindsay Long will share findings from the provider survey about gaps in care.
Thanks, Beverly. So I'm going to speak about gaps in care from the provider survey. There's a few different touch points I wanted to articulate tonight about what the report showed. So one thing that Beverly quickly touched on was that of the providers that responded to the survey, 62% of those providers offer a sliding fee scale to some degree for clients who don't have insurance. So based on the survey and the questioning and the report, we didn't understand really to what degree it was adjusted. We just know that 62% do offer some sort of sliding fee scale. Next point I wanted to articulate was the survey gauged the percentage of providers who offered services in other languages other than English. So in this survey, 13% of providers who responded reported offering services in another language. This is a 6% decrease from the 2021 survey that was reported on. This comparison is approximately 19% of the population who speak Spanish or speak another language other than English in the home in this surrounding area. Other gaps that were also pulled from the report are that were highlighted or cited. The biggest gaps were a need for an inpatient mental health treatment center. This was also congruent with the 2021 report. So very similar data points. In addition to inpatient mental health treatment center, there was also referenced gaps, including intensive outpatient treatment, followed by crisis stabilization, emergency housing, alcohol and drug rehab services, psychiatry and med prescribers, peer support specialists. So because of these pretty immense gaps in our community, we often find that clients and patients are leaving our community to find these services and sometimes traveling hundreds of miles away to seek care in other communities or foregoing treatment altogether. So up next, I will introduce Charlotte Alexandra. Where is she? There she is. And findings, she will share about findings from the provider survey about provider well-being.
Thank you, Lindsay. Hi, I'd like to take a moment to talk about the well-being of our local behavioral health providers. These are the people who help others with their mental health, but they're dealing with their own challenges as well. As you can see on the graph behind me, our survey asked local providers, how many days during the past 30 days would you say your mental health was not good? On average, they reported 5.3 for mental health days, which is higher than what we see in Wyoming overall at 4.1 and higher than the national average of 4.8. That's a lot of tough days for the people who are working hard to help others. This is better than what it was in 2021, when providers in Teton County reported an average of 7.2 for mental health days. But still, over 20% of providers in this recent survey said they had 10 or more poor mental health days in the past month. Imagine trying to support others when you yourself are struggling. The survey also asked providers what contributes to the most stress in their work. The number one factor was limited resources for their clients, followed closely by the intensity of the work and the client load. Other factors included crisis work, current presenting problems, as well as feelings of isolation. This highlights that we need to support our providers better, whether that's through increasing resources, expanding services, or addressing the mental health challenges our providers face. By doing so, we can not only improve provider well-being, but also enhance the quality of care for the broader community. Up next, Lori Andrews will share Third Horizon Strategies recommendations from the report, and Jody Pond will share the Teton Behavioral Health Alliance's responses to these recommendations. Thank you.
Thanks, Charlotte. Nice to see all of you here. Thanks for coming out tonight. So you are taking in a lot of information, and if you do get your hands on the report, there's a lot of information in this report. So tonight, what we want to focus on are the recommendations that are coming out of that, and then Jody is going to share some of the things that are currently happening to address some of the needs in our community. Recommendation number one is to focus on the behavioral health equity within our community. The survey data revealed a disparity in behavioral health needs and access to care, particularly for our Latin and Hispanic community members. This points to the need for Teton County to focus efforts on improving behavioral health equity. Some of the recommendations include to conduct a targeted outreach and anti-stigma campaign, to look at language services and increase the ability to have providers that have cultural competencies. There are other recommendations in the report, but I'd like to give some time to Jody to speak to where we are.
Thank you, Lori. So I have the privilege of talking tonight about some of the things that we have been working on. So there is a dedicated group of individuals that have been meeting through this initiative. This is people that have worked long and hard over many, many years and continue to work on this issue. So that is the good news. Some of the things we have been doing to focus on behavioral health equity include the Mental Health and Recovery Services, Teton Youth and Family Services, St. John's, and Teton County School District. Number one, adhere to the culturally and linguistically appropriate standards. At the Teton County Public Health Department, our community health outreach workers conduct regular outreach at the Teton County Library. And they help connect individuals in Spanish and English to services throughout the community. The Jackson Hole Gender Diverse Project provides support groups for gender diverse individuals and workshops for providers who work with gender diverse youth and adults. St. John's offers a language line for translation services and free maternal mental health program. And lastly, but not least, and there are so many other examples, but we have very limited time tonight. Mental Health and Recovery Services offers a sliding scale up to 700% of the federal poverty level for free state-funded services for priority populations.
Thank you, Jody. The second recommendation is about increasing prevention and early intervention activities. The survey findings indicate there's a need for additional activities that address prevention at the primary, secondary, and tertiary levels.
Okay, so some of these activities that have been going on, St. John's Health Outpatient Clinic, they screen every patient at every visit. Mental health first aid and safe talk trainings occur regularly in our community. For years, we've had crisis intervention training for law enforcement. The Community Prevention Coalition has done public service announcements related to gun lock safety. They also do drug take-back days for safe disposal of prescription medications. At the school, there's a great program called Lose the Views, and this is a peer support program for high school students struggling with nicotine use disorder. The Teton County Library holds a silent disco, and it's an alcohol-free event. You may notice that there are more and more mocktail options at local restaurants. And then a shout out to our community health outreach workers. They recently did a program called 20 something. And it was a multi-week program this summer where they had different topics every week. It was an alcohol-free setting for young adults in our community to meet other young adults and learn about different health topics over the summer.
The third recommendation is assessing the existing continuum of behavioral health care and to conduct a market analysis. As discussed earlier tonight, respondents to the provider survey in 2021 and 2024 cited inpatient mental health treatment as the biggest gap in the community. Intensive outpatient treatment and crisis stabilization were also identified as gaps in the treatment continuum.
So some of the things that are occurring, we are launching tonight. You'll hear more about the behavioral health dashboard. We're really proud of that effort. Michelle will be talking about that a little bit more tonight. We've also mapped the behavioral health continuum of care, so we can see where what we currently have and where gaps exist in services. We also have had a suicidologist, Dr. Kent Corso, provide a policy summit, and he has taken that work that he does nationally to the statewide level, and we are reviewing and incorporating his recommendations from the policy summit into our crisis response work. And the Alliance has been networking with our sister communities and other mountain resorts to learn more about their plans and strategic plans, so we can see what other communities are doing that have similar issues.
The fourth recommendation is really focused on the survey itself and to build on the findings. The recommendation is that the Alliance build on the existing findings and utilize additional tactics for a more robust understanding of the behavioral health needs in Teton County. First, a comprehensive review of how questions are worded and ordered in the community and provider surveys would be helpful. Second, it would be helpful to add questions about substance use beyond alcohol. Third, include a larger pool of respondents would help mitigate confidentiality concerns and facilitate a deeper analysis of health disparities for some of our key populations.
And so some of the outreach that we did, we engaged Toto TV for outreach in the Spanish-speaking community. And then we also engage with historically marginalized community members in focus groups, surveys, and the like.
And the final recommendation is to explore the feasibility of bolstering peer supports and other services from non-licensed behavioral health professionals. A peer support group is someone who, with a lived experience of recovery from mental health conditions, substance use disorder, or both. They provide non-clinical support to others experiencing similar challenges. By sharing their lived experiences and practical guidance, peer help people develop personal goals, access community resources, and take concrete steps toward building fulfilling and meaningful lives.
And so some of the things that have been done in the past around peer support include the Latina Empowerment Circle. And this has been a project of the Community Safety Network and our community health outreach workers. And I think we will be in our 3rd year this winter. Yeah, so that's been going on for a couple of years now. The TIPS program, which stands for Teton Interagency Peer Support, and that's for first responders. Alcoholics Anonymous is also a peer support program in our community. And then the Community Safety Network's Peer Advocate Program promotes healthy relationships, education through peer-to-peer support at local high schools.
We'd like to invite Michelle up.
Yeah.
Michelle, let's talk about the dashboard.
Hello, everyone. Thanks for being here. I mean, as we have seen tonight, as is really obvious, challenges in our community, like behavioral health, are much larger than any one organization or any one individual. And that's the role that Legacy Works plays. We come in to help support and catalyze organizations and outstanding groups like the Behavioral Health Alliances to meet challenges and opportunities at the scale and the pace needed through tools like collaborative facilitation and data dashboarding. We have seen time and time again in our work that when we silo resources and when we silo information, that we can't create the change needed in communities. You've seen tonight how important this information is, which is why public access to this information so that we can all act to create change in this important space is so very important. Kate, let's go to the dashboard. This is the landing page. This is public and launched. So yes, after this meeting, you too can go there. This is the Teton Community Wellbeing Dashboard. And Kate, if you can get the framework, the circle centered. The idea here of this framework is that these 8 focus areas roll up to a measure of well-being in our community. And that a dashboard to be able to look at data about these 8 focus areas in one place allows us to de-silo that information and to identify and track these metrics of well-being in our community, to know that we are making the investments and the actions in our community that are creating the change that we intend to have happen. With the generous support of the Community Foundation, we started a little over a year ago, about a year and a quarter ago, actually, on 3 of these focus areas that align with the initiatives of the Community Foundation. So that is education, housing, which has also been publicly launched, and behavioral health. Kate's going to show you how to get to the behavioral health dashboard. You hover on the top of the data focus areas. Yes, I know you want to click on that circle. I'm trying hard to be able to do that. I need some leaders on our team. If you know any, come talk to me later. Go to the top, click on health. From health, you're going to navigate to behavioral health. There is a link there to physical health resources as well. So here's the behavioral health landing page. I don't have nearly enough time to walk you through this whole page, so I'm going to strongly encourage you to go there. But I'll tell you this, the Behavioral Health Alliance worked really hard over about a year to identify the metrics that really matter, to take data from this survey, but also, as importantly, to craft a story of the work being done in our community
towards making progress in this space. So because of that, right, a couple of things, there are a lot of external resources. Kate, will you go to the 3 circles? There we go. You can link to a lot of resources. We realize that people might find themselves here that are looking for resources on this page other than data. So you can link to those resources here and find them all in one place. Otherwise, the page follows what we call meta-metrics, or a framework that was created with the Behavioral Health Alliance, which is prevention, treatment, and crisis. And so that is how the page itself is organized. And you can just take us on a little scrolling tour. This is the behavioral health continuum of care, so a little bit of grounding in the work. And as you move through, you'll also see that there's an opportunity to highlight, as was done tonight, just now by Jody, the work being done in the community already. So there's projects that are highlighted, there's individuals that are highlighted that kind of speak to the work or the levers of change in the community, and an invitation, we hope, to the public to actually get involved with the work. A bunch of the infographics from data points that you just heard about this evening are embedded here as well. And when we get there, Kate, jump all the way down to the interactive dashboard. This is really kind of the heart, if you will, of the dashboard pages. So this is an interactive dashboard. It uses a program called Tableau, for those of you that like to dork out on this like me on dashboarding. And it's interactive, meaning that you can click, you can see the 3 big boxes that say prevention, treatment, crisis. You can see the subcategories over to the right. And if you look at the data down below, some of this will look familiar because this is the data from the surveys that was presented to you this evening. So when you want to go and remind yourself about this important data, this is where you would go into the explore data buttons, get you to this interactive piece. And you can use this to help inform your own work in the community. Really, this is intended, again, to empower so many of us that are working either in the space or adjacent to the space to find the data that we need that helps us track our progress. And again, those levers of change in the community. You can on I don't want to go too far down into these buckets. I will share a couple other pieces. Kate, if you go down just a little bit more, you can see.
Michelle, you have time.
I do? Yeah. You know, I could go on it for so long. You guys have been playing with me in this space for so long. There's also a link here to the Cats Amsterdam Foundation dashboard. So you can spend some time exploring the data about our community from these surveys. You can also link out to the Cats Amsterdam Foundation, which shows this data relative to those other peer mountain communities that were mentioned earlier this evening. We are working on a couple of features that are not active right now on this dashboard, right? You can click on the dashboard and translate the dashboard itself into Spanish. We are working, and in the next about 2 weeks, this Tableau will also translate as well. We learned we had to do that part separately, so we're working on that, which will be great in making that more accessible to our community members. And also those embedded infographics will also be translated to Spanish. There is also additional data from the provider survey, which is not yet integrated into that interactive Tableau, but will be. Now, the idea of a dashboard is that it changes, and that's really important. So the dashboard is meant to be a tool for the Behavioral Health Alliance and for the community at large. That group will continue to revisit the dashboard to change the story as the conditions change in our community. So constantly iterated upon, updated as the work is being done. I will invite anyone else that wants to add about the dashboard. Oh, yes, feedback survey. On every page of the dashboard, you will find a link to a survey, and this is a user experience survey. This is very much in beta form. The behavioral health page launched about a month ago. It's been about 2 months-ish, 2.5. since housing launched, which is great. Education hopefully launching, within the next few months, probably sometime this winter, an early prototype of that, which is super exciting. It changes as it grows, and we know that every user brings their perspective and lived experience to the dashboard. So if you are interacting with this tool, we are very eager to hear about your experience using this tool so that we can continue to refine it to meet the needs of our community. You can also just email me too, if you don't like forms, that's great too, so feel free to reach out. Thank you so much, really please go to the dashboard, we're super excited about the tool. And I'll say one more thing, like what really sets this, there's a lot of dashboards, people love dashboards, they're very tough these days. What makes this unique is that it really is built by the community for the community. We spent a year building this page alone because it was about the people in our community who are doing this important work, informing the framework. We measure what matters and we act on that as a community. And so I really just want to express gratitude for all the partners that are on this list and in this room today, because they did an outstanding job shaping what this is and really owning that. And so it's been a wonderful process. I'm going to toss it back to you, Kate.
Thanks so much, Michelle. We have shared a lot of content with you today. Thanks for bearing with us. This session is being recorded, so the recording will be distributed. So if you maybe spaced out and started thinking about what's for dinner, you can watch the recording. You're welcome to share this recording with others. I know that I've been in communication with our partners in other mountain communities, so this will also be shared with them. So know that that's available for you. In addition, the report that we've been referencing will be available tomorrow on the Community Foundation website, and that will also be shared broadly. We wanted to make sure that we could dissect the report before it was put in everyone's hands. But again, the idea is being able to put that information in our community's hands so that you have access to it. But with that, we do want to provide time for questions and answers this evening. I will be facilitating that, but I will not necessarily be answering all of the questions. So if you are a person in the room and I know that you can answer for those things, all of you could potentially answer a question. So be forewarned. Stuart, wanting to make sure on the Zoom, if individuals have questions, you can either raise your hand or type them into the chat. And Stuart, as you see those, please let me know. Who's the brave person that's going to kick us off with questions? Thank you, so brave.
Your survey characteristics are good, and I've done a lot of national work on substance abuse. What I don't see is the interaction with age. And was that asked of the survey and you don't have that data? Or you didn't realize that age drives a lot of the substance abuse issues, as well as sex?
Yep.
So can you treat all your parameters with an interaction statistically on age and sex?
DJ, do you feel like you can feel that, or do you want me to?
You can go ahead.
Okay.
I'm sure it's the same answer.
Great. Great question. The entire report is a 34-page document that has an appendix that has a graphic, visualization of the data to go with every single question. So each question is broken down by demographics. So you can see it by age, you can see it by gender, you can see it by Latin A, non-Latin A. So the information is there. It's just, we did not have the time in tonight's venue to be able to speak to every single breakdown of it.
Yeah, but that's not the point. The point is the age driving, for instance, the alcoholism issue? Is age driving, for instance, overall mental health issue? Is age driving the number of days individuals feel they have a mental health challenge? It's really important because age cohorts drive that nationally.
Right. I'm gonna see if there's a provider in this space that feels like they can speak to this.
Wow, I'm really surprised about that.
Go ahead, Owen.
I love the question I'm gonna add to it, because be able to take this data with its divisions and put in an age cohort division is important because there are times and places when mental health issues emerge more significantly than others, especially with the gender breakdown. Another one is the economic differences, because we have such a large disparity economic. And that would be the way I take this whole thing and turn it over. Really, really interesting.
Thanks, Joanne.
I'm not gonna speak to the results, but I will say that you can filter for these demographics on that interactive dashboard. So you can go and see if you sort by different age ranges, income ranges, and other demographics, what that does to the data to draw.
Thanks, Michelle. Question in the back.
That too.
Great.
How does the survey, or did the survey cover, disabilities of disabilities that in this population? Questions about that?
Anyone feel up for answering that? Looks like I will. The survey did not address disability. And I think that that goes back to some of the recommendations that Laurie spoke to, of that we aligned our survey to be in agreement with what 7 other mountain communities were also asking. And so our ability to customize the survey to really address questions that feel relevant and important in Teton County. We only had flexibility to customize 5 of the 38 questions. So I think as we review the survey, that's definitely something that we can consider and adopt into future iterations.
And how do we share information regarding additional resources and, groups that are available that don't seem really for us?
Great. I'm gonna put Francis on point for a second. Francis, would you speak to Network of Care and Credible Minds?
So on the dashboard, you'll see different ways of connecting to a site called Network of Care, and Network of Care is a joint project between the health department and St. John's. And it serves
St. John's Health.
and it serves as a service directory and also a database for county banking. So it has a lot of different purposes, but as a service directory, we've cross-listed current agencies, services in our community for folks that are looking for them. And we've continuously updated it and are continuously updating it and outreaching it in our community. So I would say like connect with me, because that's kind of one of the projects that I'm really passionate on, of getting that directory, continuously reflecting the things that are offered in our community and linking with the people.
Thanks, Francis. It's Katia, right?
Yeah.
Go ahead.
So the community size of, who took the survey was 1,142. What was the age spread in that?
I don't remember off the top of my head, but it was for 18 and older. And that was a limitation of the survey in terms of what we could do in coordination with the Cats Amsterdam Foundation. I would have to look back to the data specifically to know what the top end of that is, but that is in the report and in the appendix that will be distributed tomorrow.
So there's a way to see like how many people who filled it out were over the age of.
Yes, there's an entire section on the demographic breakdowns, and it includes zip code, it includes gender identity, sexual orientation, age, income bracket. Help me out, am I forgetting anything else?
Would you like a demographic overview real quick of numbers?
Sure.
18 to 39, 373 people, 40 to 64, 551, 65 plus was 218.
Thanks, Laurie.
These are numbers very few groups have. This is very strong data because you have the cohort numbers, which is the N, that's the population. My only last thing is a plus. In the state of Wyoming, in the state of Arizona, we have what's called an ADCRC, it's an Arizona Disease Research Commission. Okay, and it's for diseases that are specific for the state, or mental health challenges, or neurodegenerative issues in the state. Do you have anything within the Wyoming? And anybody can apply for the funds, any group can.
Yeah,
And they're very favorable on their response in Arizona. Do you have anything like that in Wyoming?
I'm gonna see if Sarah Cavallero can answer that. Or if Andy Schwartz can answer that. Andy, I have to say that I looked to Sarah and she pointed to you directly.
So,
Andy,
thank you for the question. I can't answer it. I was a legislator for 8 years. I am unaware of anything comparable in Wyoming, but hidden in the Department of Health, there might be a program.
That's where we have it. I mean, I'm a resident of Wyoming now, but that's where it's.
I think Jody might have an answer. See, this is called crowdsourcing information. I love this. Jody, thanks.
So going back to network of care, a point for that. So that particular website has over 130 health indicators, and they're all national data sets, whether that be the CDC doing studies in our state. And so you can find that information. We don't have what you're talking about in terms of something specific in Wyoming. As a matter of fact, we don't participate in the behavioral risk factor surveillance survey for youth. The legislature opted out of that national data, which is really a shame, although we do have our own prevention needs assessment for under 18, which we link to that on network of care. So if you're looking for these national data sets where we have data for Teton County, Wyoming, and the US, we can compare those.
But
Thank
I
you.
understand what the national is, but what I'm trying to say is that 3 professors in my department went to Phoenix. We got the ADCRC started because they wouldn't sit down until the legislatures listened to it. And it started as a very small core of money. Now it's a minimum of $20,000 to $50,000 a grant, and anyone can apply for it. Any group that's got a need and a behavioral issue, which the state has problems with as well. So all you have to do is you show your data sets.
You know, we will have an opportunity at the end of the evening to sign up to volunteer to be involved in these, and it seems like there might be some potential there. I'm gonna check in with Stuart and see if we have any questions from our virtual space.
There are not currently any questions.
Okay, anyone else in person? Yes, in the back.
So I feel like purpose and autonomy is a big driver for people's mental health and stability. Is there resources or funds available for people who have ideas for how to get more community involvement or more activities that aren't surrounded by alcohol to kind of facilitate community driven, that's not dependent on service providers and do have something like that?
Do we have something like that?
I would venture to say that the closest thing is that there is a micro grant program at the community foundation. Lori, do you know if individuals can apply for that, or does that have to be on behalf of it has to be on behalf of a nonprofit or agency?
But there is the Teton County Prevention Coalition, which has large members, and it's not just the organizations and providers that are in it, it's interested community members. And that's through the health department.
And I would also say it's not exactly what you're speaking to, because what I hear you saying is someone coming up with the idea and wanting to implement it. Charlotte, I'd love for you to speak a little bit about the work that your agency is doing and the number of programming that you folks are offering these days.
Yeah, thanks, Steve. So I'm the executive director of the Mental Wellness Collaborative. We're a fairly new nonprofit, started about 1.5 years ago. We have several providers in the room who are amazing. All our providers are amazing. But we're really working on easing access to mental health care. All of our providers do about 1 free community event per month, so we have about 8. the topics range, but we had a peer support for early recovery group that was happening. Started as a one-time thing and then they wanted to continue it. So we have a lot of different innovative projects and we're totally open to community members who have cool ideas. We have a space. If you have an idea, I have a business card, reach out to me. Yeah, we're really open to collaboration. Because I know that there's just like a ton of nonprofits and a ton of money in this community, and it's just like how to get more people excited and actively involved to help. And I think it's an idea to help reduce stigmatism about, you know, like just an environment for people to tell their story. That's all we want is, you know, like connection and community. And then, so I'll be in touch, but.
Awesome. I also think Beverly wanted to add something to that.
Yeah, so the Community Prevention Coalition of Teton County and the Suicide Prevention Subcommittee is open to anyone to attend our monthly meetings. And we have 5 areas of concern that we work through, and so adult overconsumption of alcohol, underage drinking and THC use, tobacco, so all forms, vaping, combustibles, smokeless, opioids, illicit drugs, and suicide prevention. So, and while we're not providing services, it is definitely a platform and a group of caring individuals and partners who come together, right, to find valuable solutions and enhance programming that is already going on with our invested partners. So to enhance that for them, to help them, lift them up. And peer-to-peer programs, we know, like with Lose the Views and other different programs that are out there with individuals that have shared experience, it makes a huge difference. And then that's not requiring the individual therapy and so on, because peers do amazing things for each other through that lived shared experience. So, and that is open and welcome, and yeah.
Thanks, Beverly. We have time for one more question. Go ahead, Oanne.
I have a 2-part question.
Nope, just one.
In the one of the earlier screenshots, you had providers and what carriers they were, part of Medicare, Medicaid, private insurance, etc. I would venture to say in this town, the private insurance thing needs to be broken down. Because, for instance, we only take Blue Cross Blue Shield, and yet the school district has signed up with Cigna and creates total havoc. And I'm just gonna throw it out there for you to take a look at.
Yeah, that is definitely something that we're aware of and not causing barriers to care.
Yeah.
So thank you for, yes, we agree, and somehow maybe collectively we can come up with a solution. Did you have a follow-up to that?
And what was the second question? Oh, I know, it had to do with the 988 number.
Oh, yes.
Andy, I understand the state legislature. You're the
Full disclosure, I quit.
Knowledge, you've done a lot.
Okay, go ahead.
My understanding is the state legislature decreased their funding for 988.
My recollection was they actually approved 988 and then didn't fund it.
Well, that's worse.
So Beverly sits on one of the
I'm like,
boards of that group. So Beverly, you want to take this?
Yeah, so Wyoming Alliance for Suicide Prevention is a statewide coalition, and so 988, first time ever when that launched in July 16 of 23. We had 2 call centers in the state of Wyoming the first time ever, while the 1-800-273-8255 number has always existed for crisis. it went to 988 nationally, right? So
Right.
remember, so our call centers are in Grable and Casper. And all calls from a 307 area code are answered in Wyoming. So they each take 12-hour shifts, so they're covered 24/7. And again, they answer by area code, so if you have a different area code, it's
Oh,
gonna
you
be
sell
routed to that state. They are working on that GPS, and that hopefully October, that might change and we'll have that advantage there.
I'm
As
concerned-
far as legislation,
And funding.
yes, so you're right. In legislation, they did like, yeah, let's approve that, let's get it. We wanted $40 million for that.
Gee,
We got 0. However, we did get the 988. Now it has gone into where it is managed financially and everything through the Wyoming Department of Health and through prevention. And we did get some money this last legislative budget session. We didn't get anywhere near what we were hoping we would get. So, I mean, that's something we keep working on, and that is something prevention does and coalitions around the state, because every county has one. Coalition members, they can talk to legislators and people, community, anybody that is decision makers to be like, help us fund that. Because what we're seeing is that it's making a huge difference for our state. We've also seen an increase from those aged 13 to 17 years old since the text chat has come up. It has increased leaps and bounds. And the calls and interactions are going from 20 minutes on a phone call to an hour and 10 minutes. So we need more crisis counselors answering those phones. So the money, we have to get the money.
And thanks, Beverly. I'm gonna pause us there. We are running out of time. I thank you. We can talk about all of these topics for a super long time. But to be mindful of library hours, I'm gonna say thank you for attending this evening. I have a couple of pieces of housekeeping as we wrap things up. As I mentioned, the full report will be available tomorrow on the Community Foundation's website, and it will be distributed broadly throughout our community. In the meantime, please, please, please do this. I invite you to scan the QR code and complete a short questions to indicate if and how you would like to be in touch with the Alliance. I'm gonna ask if you are a member of the Alliance, please humor me and go over there, and we are going to have a group picture. If you are not a member of Alliance, I invite you to take some snacks, have some cookies, and stack your chair on the side. Many hands make light work. Thank you so much for being here this evening. I really appreciate it.
Yeah, forget it.